everyone. We can see you're just joining us. I am going to give it a couple of moments till everybody is in, but you are most welcome to this week's edition of the IIOP in Conversation with Breastfeeding Support, the role of the pharmacist. You're all very welcome. A few domestics before we introduce you to our two speakers for this evening. So the first is, to be clear, this webinar is being recorded. We'd suggest you keep your microphones muted throughout. At the end, during Q&A, you'll be welcome to turn them on if you so choose. Probably better to keep videos off, especially as it improves connectivity for you. If there's a difficulty with the sound, while you may put some queries into the chat box, but we just suggest you confirm that the sound or speaker isn't muted or turned down on your phone or your computer. If all else fails, try logging off and coming back in again. That usually resolves it. We do have the chat function open. So pop questions or comments in as we go. You don't have to wait until the end. Sometimes it's nicer to kind of have a number of them there for the speakers when they finish the formal presentation. We may use some anonymized information from the webinar. Be reassured it will be anonymized, but sometimes some very useful themes are picked up from the chat box. And of course, what is most important is to encourage you to complete the post-webinar survey. I know that the link is being put into the chat box right now, and we'll re-enter it into the chat box at a later stage during the evening, just to make sure if anybody happens to join us late, that they pick it up as well. We'll give you another little reminder on that at the end of the evening. So our two presenters today, we have Dr. Deirdre Darcy, who's an Associate Professor in Pharmaceutics and Pharmaceutical Technology and Director of Undergraduate Teaching and Learning at the School of Pharmacy and Pharmaceutical Sciences in TCD. And our second speaker is Dr. Aoife Fleming, who's a Senior Lecturer in Clinical Pharmacy and Vice Head for Interprofessional Learning at the College of Medicine and Health in UCC. Welcome, Deirdre and Aoife, and I'm going to hand over to you now and turn off my video as well.
Thank you very much, Cecily. I'm just going to share my slides now. That's okay. Okay, can you see my slides there, Cecily?
Yeah, working hard.
Brilliant. Okay, thanks a million. Thank you very much for the introduction. I'm delighted to have the opportunity to contribute to this webinar this evening. I'm going to say a little bit to introduce myself, and then I will hand over to Aoife, who can introduce herself. Then I'll talk for a while, probably about 20 minutes, and Aoife will talk for a similar amount of time, and then hopefully we'll have a chance at the end for some nice chats and discussion on this topic. So, yeah, this is me. I started off my career as a hospital pharmacist in the UK quite some time ago now, and I did a PhD in pharmaceutical technology. So I've, I suppose, quite a broad career base from back then. I have had an ongoing interest in clinical pharmacokinetics, and I guess that was what first sparked my interest in this topic of breastfeeding support. Because it is obviously a very complex pharmacokinetic problem. You've got two different patients with very different physiologies. And then I suppose through some breastfeeding experience of my own, my eyes were opened a little bit also to some of the greater pharmacy needs of breastfeeding patients. So this on the side is all about what I am, but I think I should probably emphasize what I am not. I am not a lactation consultant. I am not obviously a midwife. I'm not a behavioral scientist or psychologist. I am also not in community practice on a day-to-day basis, though I do have some great teacher practitioners here that I run my thoughts and ideas past for sanity check quite often. So I hope I'm not totally out of touch. And just in terms of my own attitude towards breastfeeding, I think it's important to be aware of how your own attitude to a topic like this can impact on your sort of practice perceptions. So I think that breastfeeding is the physiological norm. So as long as people are having babies, there will be breastfeeding women and breastfeeding patients. Having said that, of course, there are other feeding decisions, and the most important thing is that the baby is fed and the mother's health is looked after insofar as it's possible. So with that, I will pass on to Aoife to introduce herself as well.
Thanks, Deirdre, and hello everyone, and thanks for the opportunity to contribute to this webinar. So I've enjoyed working with Deirdre in creating content for this and having discussions around breastfeeding and all things breastfeeding and community pharmacy. So similar to Deirdre, I'm not a breastfeeding expert. I'm not a lactation consultant or specially trained in this area, but I have experience of working in community pharmacy and even hospital pharmacy, and I suppose coming in touch with families and mothers who looked for support in breastfeeding at times. And I suppose, you know, many of us here have trained on pharmacy programs, and I suppose I became aware at stages of my earlier career of gaps in my own knowledge and my confidence at those times. So I suppose that kind of sowed the seed for some interest in this space, and it being an educational need of my own. And then moving forward then in terms of my current role in education of our future pharmacists, it's something that we are aware of in terms of what are the needs there. Similar to Deirdre, had some breastfeeding experience of my own and some challenges as well, and very much became aware at that time of the support and the vital role of other healthcare professionals in this space, even though I, as a trained pharmacist, was feeling quite at sea at that time. So fast forward to now, I'm involved in, you know, several different areas of clinical pharmacy and practice research. And one project that I've been enjoyed being involved in over the last year is the Max SBF study, which is a study in UCC, and I'll speak a little bit more about that later, all around support for breastfeeding. So with that, I'll hand back over to Deirdre for her continuation of the webinar. Thanks, Deirdre.
Thanks a million, Aoife. So yeah, just a very higher level overview here. I will very briefly outline, you know, what role a pharmacist might have in helping the breastfeeding patient or what the patient might be looking for. I will talk a little bit about some barriers to pharmacy support for breastfeeding patients, and then something about information resources that we can look to for medicines information breastfeeding patients, and indeed maybe some sort of future perspectives on where those resources might go, and talk a little bit about my own ongoing research in the area. And similarly, Aoife then will talk about breastfeeding education, competency development and communication, and indeed some of her own ongoing research as well. So in terms of pharmacy support for breastfeeding patients, here's just a snapshot of some papers that have looked into this. There've been quite a few papers looking at, and I'm talking, I suppose, about community pharmacy support mostly in this presentation. So there's been quite a few papers looking at surveying pharmacists mainly, and looking at their views on pharmacy support of breastfeeding. There's been quite a bit from the US and from Australia. I was involved in a collaboration with Jordan over the last couple of years. And although there are these different geographical and cultural contexts, I think I can broadly say that there are some, you know, similar sort of broad findings, such as that pharmacists in practice do come across and do encounter, of course, breastfeeding patients, that they do support them and advise them, and that they want to, with varying degrees of confidence, and that there was kind of, I suppose, a general trend towards an expression of desire for ongoing access to further education in this area, because obviously it's a kind of an evolving area all the time. So first of all, then, I will present some research that I did looking at maybe potential barriers to pharmacy support of breastfeeding patients. Now, I should say that this was conducted about 10 years ago. These results are about 10 years old. So some, you know, things move on, things evolve. Some of them will not be so relevant anymore, but some are less time sensitive and I think very definitely relevant, and they're the ones that I will focus on. So this was actually a fourth-year project, and basically we sent a survey out, disseminated among many breastfeeding patients, an anonymous survey. Many were respondents came from a particular breastfeeding support forum. It was Ireland focused as well, so it was mostly, as far as we know, Irish respondents, or respondents based in Ireland, I should say. And the survey was mostly sort of a tick box survey asking about the expectations of support from the pharmacist or the pharmacy setting. But at the end, we had one free text question, and we just asked if you perceive there to be any obstacles or barriers for support of a breastfeeding patient, breastfeeding mother from your community pharmacy or pharmacist. Can you describe those barriers? And we had 65 comments to that. And we did a thematic analysis of that data. Now, just as a reminder, if anyone's not familiar or needs a reminder of what that means, it means that we went through every sort of text and phrase in those comments and assigned a theme or code to them. So, for example, if you're thinking, oh, respondent number 7 said something similar to respondent number 23 along the same lines, that was given a certain code and a theme identified. That can be done manually, or there's software that can do it as well, but it is important that you use more than one method or more than one analyst, let's say. I should emphasize that we did not ask patients, are you currently using a pharmacy and what are your pharmacy care needs? We asked them just what their perceptions were about potential obstacles and barriers. Also, when we identified 6 themes in this data, and just to say that means that all of the phrases in the comments we received aligned with at least one theme. We caught, I think, every sort of perspective that was out there, but it doesn't mean that every respondent's views were all of those themes. So we had Rose Dagnan, who was my 4th year project student at the time. She did a great job. She did the analysis. I also did the analysis, and because this was my first time actually engaging in qualitative research, I'm normally a quantitative person, Professor Martin Henman in TCD here helped me with that. And then Dr. Suzanne McCarthy in UCC also joined us as another independent analyst of this data. So as I said, 6 themes were identified, and I'm only going to really focus on 3 of them, the first 3. The second 3 were these. One just was about sort of products and resources that maybe the respondents would have liked if they're available in the pharmacy. The others related to maybe a perceived conflict of interest for the pharmacy, or maybe a little bit of misunderstanding about the role of the pharmacist being to treat sick people rather than breastfeeding, which is not an illness, as one respondent said. But since then, we've had the pandemic and everything else, perspectives may have changed. So I wouldn't be saying that this necessarily reflects current views. That's speculation, but I'm not presenting it as that. The first 3 themes that we identified, I will focus on these ones because they're really, I think, still relevant and very core important themes. First one up there was knowledge on safety of medication in breastfeeding. And there was a sort of a view from several respondents that pharmacists tend to err on the side of caution and just consult the product leaflet and product information. And if you note this respondent here, excuse me, she kind of lists, presents a list of resources of medicines information in breastfeeding. And she's saying that pharmacists and other healthcare professionals, in her experience, don't necessarily seem to be familiar with those resources. That kind of ties in very closely with the third theme, which was that some respondents were saying that rather than going to their pharmacy for medicines information on medicines used in breastfeeding, that they would go elsewhere. They would either look to resources themselves and interpret it themselves, or they would ask each other, for example, on these breastfeeding forums or breastfeeding friends, or they would ask somebody else. So in other words, if you combine the ideas from those 2 themes, there's maybe a perception that pharmacists err on the side of caution, are not necessarily familiar with the specialist information sources, and mothers are going elsewhere for their medicines information needs and pharmaceutical and care needs while breastfeeding. Again, to emphasize, this doesn't mean that all respondents were saying this, and we had some very nice and good respondents as well. This second theme here is really important, and this was about a lack of knowledge, general knowledge around breastfeeding. So breastfeeding behaviours, the mechanics, let's say, of breastfeeding, and even the guidance. So the WHO recommends to breastfeed exclusively for 6 months and partially thereafter, up to 2 years or longer if you want. So for example, if you're in the pharmacy and there's some sort of toddler of sort of 1.5 to 2 toddling around, yes, they could still be breastfeeding. That's completely in line with recommendations, let's say. Or even that breastfeeding babies can feed up to 8 times a day on average. If they're being exclusively breastfed, up to 16 times a day. Sometimes they can cluster feed frequently. Feeding can take some people a long time, others less time. Expressing milk comes more easily to some people than others and can take quite some time or not, depending. So that's not even going near any of the problems that can arise in breastfeeding, but just some of that basic knowledge. So in terms of the information resources on medication safety in breastfeeding, I think, it's something, and obviously an occasion like this, a webinar like this, there could be a huge range of knowledge from specialists to those more sort of new to the domain. But it is within our core expertise as pharmacists to consult specialists in literature and resources on medication safety, and even to consider that we have the expert patient who will know something about their own medicines is something that we're familiar with and can update ourselves, I think, with relative comfort, I suppose, in this area. But maybe this other part about not knowing sort of breastfeeding behaviours and mechanics of breastfeeding, that might be something that some don't have that knowledge base of. It might be a blind spot even, that people aren't aware that they didn't have the knowledge base. I can speak for myself and say before I had my own personal experience of breastfeeding, I had very limited knowledge, but you shouldn't have to have the lived experience of a physiology to understand how that impacts your medicine's use. So I think this is a really important point, and Aoife is going to be dealing a lot more with that sort of idea of learning from other specialists in breastfeeding. So you can have really good knowledge on medication safety and breastfeeding, but you can't necessarily give pragmatic, usable, practical advice if you don't understand how breastfeeding itself works. So they're sort of the main points I would take from that. In terms of then just some sources of information on medicines use while breastfeeding, excuse me, sources of information on medicines use while breastfeeding. As I said, there are some, I'm sure, on this webinar who know all these sources very well, and people might have different favourite places, favourite jumping off points, if you like. So I'm just going to present some that I think are useful. Before I do, this little paper that I have up here at the top, it's not such a little paper, in fact, just a little image. It's an open access paper, and it's quite interesting actually, but it just refers to looking at pregnancy and lactation labelling from FDA and EMA. And it just reminds me to say that, one of the maybe critiques of or criticisms of one of the respondents to the survey was that the pharmacists tend to, go to the product or rely on the product labeling too much. But actually, of course, we do have to look at the product labeling. We need to know what the product license says about, and some of the product characteristics says about use of the medicine in breastfeeding. However, if that says, that breastfeeding is contraindicated completely, or even that it's fine to use this medicine in breastfeeding, statements at those two extremes are kind of easy to make to support our decision. But many statements on the product label are much more nebulous and along the lines of risk, if risk outweighs benefit or benefit outweighs risk, or, there isn't sufficient data to recommend, etc., etc. The regulatory agencies know that we need better information to support our decision making for medicines use in breastfeeding. It's really hard to get human milk data to support that. It's very hard to run those kinds of clinical trials. There was new labelling recommendations from the FDA came in around 2015. I think it seems much better. Obviously, with any big change, I'm sure not everyone agrees, and not every product, as far as I'm aware, some older products wouldn't be subject to that update. But the EMA is also undergoing a sort of a consultation. Well, they had a consultation last year around their guidance for data to support labelling in pregnancy and breastfeeding. As I said, it's very hard to get that data to conduct those studies. I do think, I mentioned at the beginning, that pharmacokinetics is one of my research interests. There is a lot happening in the area of developing very sophisticated and advanced physiologically based pharmacokinetic models that, using very sparse data, can help to predict the kind of concentrations that we would expect in milk. These take time to build, to develop, to validate, etc. It's not a quick thing. Research never is. But I suppose what I would just say is that I would hope that there will be those sort of models will help feed into labelling and feed into the design of clinical studies. And I would hope that simply the product labelling in time will better support our decision making. Okay, so moving on from the product labelling, there are three links here. I'm not going to open the link because I'm only showing my slides, so I can't share the link, but I have a screenshot on the next few slides. So the first three that I have here are from the Specialist Pharmacy Service in the NHS site, which I just think are really nice, the way they present these different aspects of information. And then the last one, which is also really nice, is from the Medicines Information Centre here in James's in Dublin. So the first one from SPS is a website just talking about general considerations for advising on medicines during breastfeeding. The next one is questions to ask when giving advice on medicines and breastfeeding. And there's a really nice sort of template to guide your consultation there, which I think is great. And the last one there is information resources for advice on medicines and breastfeeding. So I'm just going to go through screenshots of those sites to show what I think is nice about them. So the first one is just, the first three are from that SPS Specialist Pharmacy Service site. The first one here, this is about the general considerations in using medicines while breastfeeding. So you can see the screenshot doesn't capture the whole page. I can't scroll on it obviously, but you can see the main menu here on the left-hand side and things like simplifying mother's medication, monitoring the infant, communication, and so on. There's a bit here that says timing of feeds. I'm going to come back to that because I think it's really important. Then I mentioned that there are this one about gathering the information that you need, and you can see this sort of flow chart with all of these steps. And if you press that button, the show button, it opens another list of questions. I think you can even download that as a template. I think that especially maybe if you didn't encounter breastfeeding patients that often, I think that would be a very useful tool to sort of systematically guide a consultation through medicines use with that patient, and to make sure you're sort of covering all the aspects that you're meant to be thinking about. The third one then is literally advice on the different medicines information resources. So obviously they have their own medicines information. They also give some, as I say, top additional suggestions. One of these, you'll notice here they've mentioned LactMed, and just as a reminder that in those responses from the breastfeeding mothers that we got from our survey, two of them, even on that page that I have there, two of the responses that I show and several others mention LactMed. So they know LactMed, for example, as a medicines information resource exists. LactMed is openly available. It's a US resource. It's very reputable, but not every pharmacist necessarily knows that LactMed exists. I'm sort of aware of that from a different little survey that we did. So again, being aware of where the mother has gone for her medicines information needs, and also she might not be aware of the differences in, I suppose, product labeling even between the US and here it is a different jurisdiction, obviously. So just being aware of these, reputable sites, as I say, that the moms know about. Another one here is Breastfeeding Network. Or BFN, that's another one that the mothers mentioned. And to be honest, anecdotally, I've heard people talking often about this. It is a charity which supports breastfeeding in general, and they do provide leaflets about drug information or breastfeeding medicines fact sheets, I think they're called. Just notice there is a little sort of cautionary note here, says the advice does not appear to be sufficiently evidence-based. That's sort of a little cautionary note here. If you open those fact sheets, it does give the references where they get the information from, or certainly the ones I've looked at did. And often those information sources are the same as sort of the ones that you see here. However, they've obviously synthesized the information themselves, and it is up to us, obviously, to be happy with our own synthesis of evidence or information and stand over our own advice and conclusions. But I would say it's a commonly used site, and to be aware of what, it's nice and easy to navigate as well and easy to find information. So being aware, as again, that the mother, meet her where she's at in terms of what medicines information she already has. She might be looking for reassurance that she's interpreting correctly. She might be misinterpreting. She might just not know that she needs further information even. Then the other one, of course, is the National Medicines Information Centre bulletin. So if you click on the link that I have in the slides, it brings you to another link with lots of different specialist information, one of them being this, Medicines Information Resources on Lactation. A lot of the resources listed are the same as those that were listed in SPS Pharmacy, Specialist Pharmacy Services anyway, which I have actually listed up here, excuse me, as number 2. Also down here, they have a National Medicines Information Centre bulletin from 2021. And if you can click on this link, I won't do it here, but you can open that, and that's got loads more information, including, you know, general considerations, again, for use of medicines in breastfeeding. And also what I think is particularly useful is sections and different classes of medicines. So, I mean, there is a separate one on antibiotics up here as well, but in this one, you know, sections on antihypertensives, on analgesics, for example, and you can look at those and see what might be preferred options in those classes to use in breastfeeding. I said when I was talking about, where is it coming back up? In the Specialist Pharmacy Services website, it says when general considerations for use of medicines in breastfeeding and timing of feeds was one thing that they mentioned. And I just wanted to mention this because it does come up, especially in older textbooks, maybe, that maybe you should think about timing feeds around, you know, avoiding the peak concentration in plasma or in milk, or allowing a washout period of maybe 4 to 5 half-lives of the drug, so that you're not going to be giving, you're minimizing sort of the concentrations that the baby might get. However, you know, a short half-life drug could be 2 hours half-life, 5 half-lives is 10 hours. That's a long time to expect a baby who's exclusively breastfed to go without feeding. So what they do actually say on the SPS website is, you know, to consult them if you're thinking of any of these approaches, to get specialist advice, because it's very difficult to actually properly implement this. It's probably not even practical if the baby is very young and exclusively breastfed. So I also think that it seems to be a sort of impractical approach, even thinking about, you know, avoiding peak concentrations with drug delivered orally. You've got gastric emptying, you've got dissolution of the drug, you've got absorption. The time of peak concentration could normally range anywhere between sort of 1 to 2 hours or more, with lots of variability between people. So how you can avoid a peak, to me, would be very challenging. So it doesn't make sense to me to try and time the administration of medicines around feeding, unless maybe it was a once-off and the baby was not exclusively breastfed, or you could cover that breastfeeding period with express milk that you already had, for example. But as that SPS site says, it's not a kind of routine approach to take and does need specialist advice. So this is my last slide then. Just talking a little bit about current research. The bottom part down here, conception project from the Innovative Medicines Initiative. That's not something that I'm part of, but it is something that I'm watching closely. It's a large consortium focusing, I suppose, more on pregnancy than breastfeeding maybe, but they have loads of great papers coming out about sort of developing data and information and generating it through research to guide medicines use during pregnancy and breastfeeding. Why I'm watching them is that they have some very nice papers coming out on those more advanced physiologically based pharmacokinetic models predicting medicines use in breastfeeding. They're not the only groups working in that area, but it's, if you want somewhere to start, a big sort of research website looking at what's going on in this area, that wouldn't be the worst place to start. And then finally, I'm really happy to be involved in this project, which is led here from the School of Pharmacy by my friend and colleague, Tammy Grimes. She's leading the project along with my other colleague, Juliet. Deirdre Daly, who is who's a midwife in midwifery here in Trinity, and she is actually one of the leads on the MAMI project, looking at women's health during pregnancy and postpartum, and also Sam Cromie in psychology. So it's looking at a systems engineering approach to how women self-manage their own medication needs while breastfeeding. We just started with a lovely student, Lucy, last September. So I think it'd be really interesting to get some of that data from, from the actual breastfeeding mothers, and to get more insight into that. So that's where we're at the moment. Something I'm really, as I said, excited about. So yeah, I would say there are, as I said, that many people might be aware of the medicines information sites I'm talking about, but just being aware that those sites are there, that patients might already know about these, know what resources the mother has looked at, meet her where she's at, be aware of your own, your own knowledge base around the breastfeeding as well, and just that hopefully in time the product labeling will better support our decision-making process. So from that, I will pass over to Aoife.
Thanks, Deirdre. So I'm going to pivot into a slightly different aspect here of breastfeeding support, and kind of move us into the space of considering how breastfeeding support is everyone's business, and not, I suppose, start from that kind of broad perspective and then focus in a little bit more on maybe what our needs are in pharmacy and healthcare education. So this figure here is taken from the Lancet. So there was a series of I suppose, key seminal publications in the Lancet a few years ago, reviewing and writing about why investment and support and promotion of breastfeeding at a global level was so vitally important. And that series of papers was quite strongly highlighting this as a global priority to support public health, improve the health of women and babies, and even moving into the economic benefits of breastfeeding in society and across all sorts of low middle income countries as well as high income countries. So within that series of papers, they presented this conceptual model of structural and setting-based factors which intersect to have a great influence over the individual mother and her initiation and continuation of breastfeeding. And I suppose a lot was written out of those papers and to highlight the fact that the socio-cultural and market context in which we live has an awful lot to play here. So the power of marketing and formal milk marketing and cultural perspectives around breastfeeding influence what happens in terms of intention to breastfeed by the mother and actually starting it and then continuing it. The setting in which the mother and baby engage in terms of the health system and service, the setting of their own family and community, and even their workplace settings, all of these factors as well have a part to play on intention, initiation and continuation of breastfeeding. And I suppose they wrote a lot and kind of put out a lot of recommendations around what's needed as regards interventions to help support and create, I suppose, a society and an environment globally that supports and enables mothers in their breastfeeding journeys. So I suppose kind of that's really important to consider, because I think, following on from where Deirdre has come, we're very kind of siloed almost in our approach to healthcare education in general. And I suppose breastfeeding is an area where this becomes quite evident, in that we have pockets of breastfeeding in different healthcare programs and curricula at a pre-registration level and sometimes at a post-registration level. But in terms of a universal approach and kind of standardized approach, there's certainly many gaps in how we are educating healthcare professionals to support women in this space. So next, Deirdre, thanks. So again here, healthcare professionals we know and pharmacists are very well placed to provide the support, and that's been highly acknowledged. And the importance of providing education for healthcare workers has been strongly recommended by the World Health Organization to ensure that healthcare workers have the best kind of technical and specialist knowledge and skills to support women and families in breastfeeding journeys. However, much evidence has been published identifying how healthcare workers self-report knowledge and skills gaps, that they lack confidence when, communicating and supporting women in this space, that sometimes the organizational challenges in healthcare come against us. So in midwifery units or in primary care, we're somewhat limited in terms of our time, resources to support women. The need for person-centered care is quite important here, and that kind of is certainly a gap in our educational approach. So a lot of the education we receive is quite guidelines-based and kind of at that kind of high level, and not much attention is given to, how to engage and how to support and have empathy with the individual mother. So that's certainly a gap. And again, all of this is kind of couched against the strong socio-cultural drivers and force of marketing of cow's milk formula and other influences there that play into the general cultural approach and understanding of breastfeeding in society. So again, looking at healthcare curricula, there'd be a lot of variable education across healthcare programs, and a lot of the postgraduate training then for healthcare professionals is largely focused on those working in more specialist centres, midwives, lactation consultants, nurses working in maternity units, and much less is available and kind of relevant for other professions. So I suppose this kind of aligns then with an interest of mine in terms of the interprofessional education space. And interprofessional education is all about learning from, with and about other healthcare professionals, not just sitting and receiving information, sitting beside them, but actually working together as a team to support each other in helping patients and making sure that they have optimum clinical outcomes. So this, I suppose, is an aspect interprofessional education, where breastfeeding, which is of relevance to all healthcare workers, and the two could certainly align and dovetail. And there's certainly an opportunity there to not just train and embed breastfeeding education into programs in a separate way, but to combine that in endeavour and bring, you know, students and professionals together to learn collaboratively. Next, Deirdre, thanks. So again, just to emphasise why is this important, and, you know, do we really need this breastfeeding education? You know, maybe it's enough to be able to stand out and say, you know, well, yes, breastfeeding is evidence-based, and it's important for you and your baby to you know, try and go in this direction. But, you know, is that enough? But it's been found in evidence to date that if healthcare professionals are, I suppose, promoting and providing or conveying inconsistent or potentially conflicting or potentially inadequate information, this in and of itself can have a negative impact on families and mothers in terms of their breastfeeding journey. So I suppose that has been well evidenced, and there's certainly, in terms of levels of knowledge and competency in this space, I think there certainly is a sense that we need everyone to get to a certain level of knowledge and consistency, and then signposting and referral kicks in, and I'll talk a little bit more about the levels of competency. But I suppose it's not sufficient anymore, or not enough that women would not have this access to skilled support and consistent messaging in this space. Again, we're, you know, really thinking about the key groups that support breastfeeding families. So again, you know, healthcare practitioners, of course, that includes the specialist midwives and those working in maternity settings, includes doctors, includes healthcare assistants, neonatal nurses, but then it does branch out into the community in terms of nurse support there, public health nursing, pharmacy playing a role, infant feeding specialists and lactation consultants. And, you know, this moves into the key groups of breastfeeding counsellors, peer supporters in society, and in I suppose some of the supportive charitable and voluntary organisations that are available to support mothers. And also, you know, we can't ignore the impact that significant others such as family and friends have in this space. So next, Deirdre. The next question I suppose we have to ask is, do women want this? Do women want healthcare professionals to be able to give them this information? Maybe they're satisfied that they would just get this information from very specialist sources, but it's been found that there was a large survey study conducted across Ireland, Australia and Sweden, and this was published in 2023. And one of the key themes of the women that replied to this survey was that they did want and did recommend that healthcare professionals would support and have knowledge regarding breastfeeding, as well as, you know, education of the public and ensuring that breastfeeding being visible in society and accepted in society was very strong in the findings of that survey. Next, Deirdre. Thanks. So then we have to think about what kind of education do we need. So from even a pharmacy point of view, is it enough to train pharmacists in, you know, all of the aspects that Deirdre has talked about there, you know, the medication safety, the pharmacokinetic principles? But I suppose, you know, looking at the Lancet model and the conceptual frameworks and all of the other factors in this space, there's a lot more playing into this than what we probably realise. I think if we all sat back and took a moment to reflect ourselves on what do I know about breastfeeding, and what are my opinions and what are my presumptions and assumptions about breastfeeding, there's a lot there that we've absorbed, I suppose, throughout our personal as well as our professional lives. And that's something that Fiona Dykes wrote about a number of years ago. And I found that approach very useful, because it kind of breaks down how the different types of knowledge can influence us in our health professional role. And she talks about vicarious knowledge, so that knowledge that we kind of absorb from culture and society, what we've seen about breastfeeding in society and in the community around us. She talks about embodied knowledge, so that's knowledge that we might have gained through our own personal experiences of maybe breastfeeding, or past experiences of breastfeeding or challenges in that space. She talks about practice-based knowledge and the influence of what we see in practice and how we observe other healthcare professionals that maybe we work with or train with, and how their attitudes and skill set around breastfeeding support can influence us. And then she talks about formal knowledge, which is kind of where education and structured opportunities for learning feed in. I suppose we have to think about all of those different sources of knowledge and how that influences what we know about breastfeeding and how we then kind of relay that to mothers and families. She talks about the importance of education that allows us to think about those sources of knowledge and that reflexivity and discussing it and working interactively with those that we're training with and with our educators, so that, you know, we're not just kind of didactically taking in information and you know, accepting it, that we're actually, it's kind of a two-way process of taking in this new knowledge and skills around breastfeeding, but also discussing, oh, well, I always thought this and I always thought that, and I have seen this in my own personal experience was that. So I think that approach would serve us very well going forward, and that this type of education should be pre-registration, so that this is the type of education we need to embed in the healthcare curricula early on. So next. So there's been plenty of work and educational initiatives happening in this space. So I just picked one or two examples here. The one on the left here by Suzanne Campbell and colleagues, this was a kind of more general approach to providing breastfeeding education. It was an open educational resource, an e-learning or online kind of structured educational model for students and healthcare professionals across different programs. And the purpose of this model was to provide, you know, a consistent approach to breastfeeding education so that everybody reached a certain level. And throughout that as well, they embedded and were, you know, clear on the need to support diverse families. And they had a very clear EDI, equity, inclusion and diversity lens, and used case studies addressing issues with same-sex parent families, you know, how to support patients and mothers and families from lower socioeconomic groups and from different ethnic groups. So I thought that was an interesting kind of broad open educational resource, and that was published, and again that showed positive and effective learning by the participants. Another more specialist graduate module which has been recently published, and that was rolled out in UCD in Dublin. So that was an for 55, I think, healthcare professionals took part in this pilot model, and it was a bit more intensive. So this was an advanced level module for, I think, you know, practitioners working at a more advanced level of supporting breastfeeding mothers. So that required more intensive learning and 3 in-person education days to allow for that interactive learning and discussion and case-based learning approach. And again, that showed significant increase in knowledge, skills and confidence by the participants. Next. So to support us in how we think about embedding breastfeeding education in our healthcare programs and healthcare curricula, and for healthcare professionals in the wider healthcare network, the HSE and colleagues in Trinity and colleagues in ALCI, the Association of Lactation Consultants in Ireland, worked together to develop this competency framework for breastfeeding support. So I know in pharmacy we're all very familiar with what the competency framework means, but it basically sets out in detail different levels of knowledge and skills and behaviour that healthcare professionals should, or healthcare workers should have to support the breastfeeding mother. So this competency framework has essentially 3 levels. So the first level being awareness, the next then being generalist, and the next being specialist. And I think kind of for most pharmacists, we would sit at that awareness level, because we're not engaged in the full-time care of breastfeeding mother, but we maybe have some orientation in supporting the mother and child, and we have some basic factual knowledge to underpin that care and support. Moving up into generalist then would be needing competency in times and occasions where the situation becomes more challenging and there's breastfeeding challenges and you need greater skills. So you're moving into, I suppose, an aspect of providing practical support to breastfeeding mothers with issues such as latch on the nipple, or expression, or breast pumping, or practical supports like that, which would be probably beyond where many pharmacists may feel they're sitting in their practice. And then right up to specialist level, which would generally be the needs and the specialist level competency of a lactation consultant nurse. So having a look at the competency framework, even in the awareness level, it focuses more on the knowledge, and the expectation there is that you can signpost and you're aware of the benefits of breastfeeding, and that you're aware of the benefits to the mother and the child, and that you're aware of the challenges of breastfeeding, but it's not necessarily pushing you to a space where you need the skills to actually correct or provide the practical you know, solution to that, to issues or challenges as they arise, so that you have an understanding and an appreciation about that good latch is important for the baby to the breast, but that if there's a challenge there, referral is something that you're familiar with and you know how to refer on then to a specialist who can provide proper and more informed support to someone at that level. So for me, I think reading that competency framework, it's very reassuring about what I suppose the expectation is, and you know, you pick the learner level or you pick the level dependent on the needs of your role. Next, Deirdre. So again, for example, here, when this is from Aoife, and this is a useful slide. So in terms of that awareness level, you know, being aware of when should you refer to a lactation consultant, or when might a mother need specialist or generalist support from someone who's more informed and trained in this area. So again, you know, questions around managing tongue tie, you know, if somebody presents with query mastitis, if there's you know, issues around breastfeeding and looking for advice on returning to work or breastfeeding while pregnant. Again, these are the types of scenarios and challenges that ALCI and lactation consultants are you know, there and in our community to help support us as pharmacists and healthcare professionals and breastfeeding mothers as well. Next. So again, just to very kind of quickly mention, like I've mentioned, there are physical challenges and the, you know, the physical act of breastfeeding and providing support to mothers in that space, but it's been well evidenced as well in the literature of the other challenges in terms of mental health challenges and strain, and that mothers can experience in this space. So I think it's, you know, anecdotally, the challenges and the pressure to breastfeed sometimes can be quite overwhelming for mothers at any stage of the journey. And again, I suppose sensitivity around that and how to handle situations where breastfeeding might not be going in the direction that the mother herself may wish, or that she feels she's under pressure from other forces and drivers, is something that I think we need to have some awareness of in our practice. So again, it can be a vulnerable, challenging time. There can be lots of tiredness and lack of sleep and so on. And I think just, you know, the increasing, I suppose, emphasis of, you know, those factors and that biopsychosocial kind of model around breastfeeding, that it's not just the physical clinical act of giving milk to the baby, that there's a lot more tied up in this space, is important to consider. Next. Thanks, Deirdre. Yeah, I think you can skip on again. So I think just very quickly, just kind of to kind of continue that point on, I think a lot of what we might encounter in pharmacy practice are, you know, queries and questions, and there's a certain, I suppose, style and type of communication that's recommended to provide breastfeeding support. And I've just given two examples there. I thought one of the Cascade Health infographics was useful. And again, this is kind of reinforced by the WHO interpersonal communication skills for supporting breastfeeding mothers. So again, back to the education piece, a lot of what we have in the education is clinical, factual based, but it's important to think about the active listening, asking open questions, showing interest and empathizing with the mother, but again, not getting into kind of
We've lost you there, Aoife.
About where she is and where she wants to go. So again, I thought those resources were useful to look at going forward. So I think I'm nearly there, Deirdre. Probably just the last slide is just to quickly touch on the MAX SBF, so Maximise Support for Breastfeeding study that I'm part of in UCC. So again, that study will look at different aspects and social and cultural factors that are influencing breastfeeding support in society. And we'll be looking at that interprofessional education model as well, and how we can hopefully progress in that space and have our students working and learning and supporting each other as teams to help breastfeeding mothers going forward. So that's the end of the slide, Cecily. There's just some additional resources there which will be available in the slides afterwards as well.
Great. Well, thank you, Aoife, and thank you, Deirdre. That was certainly a whistle-stop tour through everything from, as you say, the social piece and then the systems and what might the pharmacist role be there. And then, of course, the two individuals involved, as well articulated by Deirdre. We have baby and we have mom, and the factors to consider there in our role. Now, I am watching for questions in the chat box, and I would encourage, if somebody would like to come in and ask a question, to put up your hand or let me know in the chat box. But while our listeners are thinking about that, can I perhaps put a question to the two of you? And it derives from thinking about the notion that our HSE have a very familiar and simple, accessible competency framework. So if we were to say everybody on the call here has some level of awareness, they knew they wanted to learn more, they have heard you both articulate so many factors around it this evening. If there was one thing, one resource each of you could point them to, if they wanted to move up maybe a little bit towards that generalist level from sort of the baseline awareness and the tips and that we would normally give in pharmacy. If I was to restrict you to one resource, each of you, what might that be?
For me, I think the resources that ALCI have, the Association of Lactation Consultants in Ireland, I think it's one of the links on the slide, and I took a few resources from there for the slides. And through working on the project with representatives from ALCI, they have very much acknowledged the role of all healthcare workers, healthcare professionals in this space, and there's a number of very useful resources around all of the physical challenges and acknowledging the empathy and the other social issues as well, Cecily. So ALCI would be my go-to. And if I were to say to a pharmacist, if you are met with a query or a question in this space, if you can find, through ALCI, a local lactation consultant, either with ALCI or the HSE, you'll be in very safe hands. And as regards training, I don't know that we have widespread training if you're thinking of a training module or option, and I think that's where a lot of the thinking and the next steps will go in terms of breastfeeding support and promotion in Ireland. Deirdre, I don't know if you have anything.
No, I think I'm not meaning to give a smart answer, but I actually think a very good first step to go would be to look at that competency framework and to see the awareness level and actually see what is expected from that. It isn't necessarily written with a pharmacist in mind, obviously, and some of it would maybe not directly applicable, but I think it would be very useful to see that. And then I'm aware of the resources that Aoife mentioned as well, and that's very definitely a good starting place.
Yeah, great. I'm encouraging and I'm watching here. Do anybody on the call want to come in questions with questions for Aoife or Deirdre? I don't see anyone popping on their microphone there. I know we've others watching. If okay, so that means I get to sort of push another point out. You both mentioned very much the interprofessional piece of it. So yes, having access or accessing a lactation consultant for specific advice. I suppose my many years in community pharmacy, I have found our public health nurse to be a wonderful source of advice. The catch is they aren't always available either, and there seems to be less and less of them. Have either of you strong feelings as to how we might, as practitioners, move forward that notion of working collaboratively and perhaps assuring that pharmacists aren't naively advising in a way that's counter to what our colleagues in other professions might be advising?
Yeah, I think that, and I know Aoife can probably talk to that interprofessional aspect obviously much more, but just to say we could be naively advising and need to link in better in terms of the breastfeeding aspects. But also I think we need to be aware that they could be naively advising on medicines aspects, and there's very definitely scope for, and everyone's coming from different knowledge base, if you like, even within the same profession. So I think there's room for that too, to sort of, for that two-way communication to make others aware that are more focused on literally the lactation and the breastfeeding side of things, that we have that medicines expertise, even for other illnesses that the mom has. So yeah, Aoife, you can probably say a lot more about
Yeah,
that.
and it's interesting because I had just following on, Deirdre, from what you said, I had a similar conversation with somebody in maternity specialist unit a couple of months ago around this area, and that she was saying how there are times, you know, the query about a medication and safety and breastfeeding might take you so far in the evidence, but if you step back then and consider, by giving this advice, what's the impact? Is the impact that the mother might decide, I'm going to stop my breastfeeding journey now and that's it, because there's this medication and the risk. But by going one step further out into, where else could I seek support here? Who else is involved? Could I make contact with a specialist consultant or somebody else, you know, involved in the care of the mother to tease this out in more detail? And there are times there that actually other options are available. So I suppose thinking about the impact of the advice you give is important. And that, you know, if you're finding it's very hard to say yes or no to a specific query without creating kind of a knock-on effect of impacting the breastfeeding continuation, I think that's where you just need to pause and say, hang on, I definitely need to refer out here and bring somebody else in and say, is there anything else? Have you encountered this before? And I think that's just something to think about, the impact. And certainly, you know, I was looking again because I had this experience myself a number of years ago of not being aware that there was a HSE-led weekly meeting in the nearby town providing support to breastfeeding mothers, like I was at a time with Challenge. And that has even expanded more in the last number of years, which is fantastic. So I think from a pharmacist point of view, find out in your town. I think one of the links on the slides, or that we'll put up afterwards, will direct you to local primary care centre meetings that happen maybe every week or fortnight with a lactation consultant, and that could be somebody that you might like to connect with. If you're in the pharmacy of a town, make contact with that consultant, and you know, you'd be surprised what they might be able to support you and vice versa. And it could be the start of something quite you know, supportive in general in that regard. Yeah, sometimes we're just not aware of all these amazing resources in primary care.
And a fabulous one thing I can do tomorrow morning when I go into the pharmacy, find out who that is, what the phone number or the day of the meeting is, and get that up on the notice board in the pharmacy and share it with colleagues.
Absolutely.
No, you're right. Sometimes
100%.
little things can be enough. We have a couple of quick questions coming in. One is around, do any of the resources give more information about medicines when breastfeeding? As in a lot of cases, the SPC will often recommend caution, and I think you did mention that HPRA tends to be conservative, and many of your links were to NHS sites. Deirdre, I can see that you have responded to that. Do you want to expand any bit? We did have some people join a bit late. Let's reassure them the slides will go out so that anything you refer to being on the slides will be available.
And I mean, the resources that I put in the links, as I said, it's also the National Medicines Information Centre here that I've given. They had really useful bulletin. I mean, the only thing is, you do always have to exercise caution with medicines use in breastfeeding. You know, it's not a sort of a redundant statement, but just obviously at the same time, these kind of risk statements that can be just unhelpful. So it's like, if the risk or the benefits outweigh the risk kind of statements, and it's like, which risks, you know, and it's not clear. But yeah, no, those specialist sites that are on the links that I have, like Specialist Pharmacy Services, and in the UK, the NHS site and the NMIC bulletin, link to lots of other specialist resources on medicines use while breastfeeding. You do need to read a bit about, if you're new to it, you need to know what the resource means in terms of, you know, how it gives us advice. So do learn how to use, and I mean, it's quite straightforward, but just rather than jumping straight in a particular medicine, do sort of learn what their statements mean, I would say.
Yeah, and one other, I see a direct message to me. I just want to access that. And it's somebody who said they were late joining, but I don't think this was actually dealt with anyway. Is this a topic that has been added into pharmacist training in university, or specifically in the pre-reg component? So I know that's close to both your hearts. Away you go.
So I mean, I have myself and another colleague here at PO, we both deliver lectures in fourth year on, I suppose one of my main points, having done that research, was like, okay, a low-hanging fruit action I can take is make sure some of this is in the curriculum. But we have to have lots in the curriculum, so there's only a limited amount of space in the undergraduate part. So I tried to hit some of those points. And Aoife,
and
pass over to you.
similarly, yeah, similar challenge. And you mentioned Dr. Suzanne McCarthy earlier, dear. Just so Suzanne, you know, would do a lot of the work in this space in our curriculum. But again, we have limited time. And I suppose what happens is the pregnancy breastfeeding piece goes together. And it's kind of prioritizing the medications, and we don't get much time then for a little bit more exploration, which is the opportunity then where interprofessional learning comes in for more discussion around cases. And you know, the beauty of the interprofessional learning part is that you could have a group of students together from different programs, and you know, you could highlight to the students from nursing and medicine or dentistry or physiotherapy, you know, if you're looking after someone breastfeeding and there's medication at play, ring your pharmacist. They'll help you with that, and vice versa. If the pharmacist is meeting a mother who's suffering with, you know, shoulder musculoskeletal pain because of the physical strain of breastfeeding, the physiotherapist could say, look, you need to refer her on to me or come to me and I can help support with that. So that's the beauty of that. But that is something we'd be thinking about in the research capacity in terms of how to optimize education in that space. And again, back to Deirdre's point about the awareness level, you know, there's a certain level we'd like everyone to get to, and then thereafter, depending on the needs of your role in your work, you know, that kind of moves into that post-registration space. Yeah.
Well, fantastic, and thanks to you both, and lots of thank yous and hearts and claps and everything coming in on the chat box. A very important topic. Great to see the role of the pharmacist emphasised, and thanks for such an interesting topic. Now, I know in my role as peer support pharmacist with the IIOP, I have a couple of very quick messages. I have put the link into the feedback a couple of times in the chat box. It's the last thing I'll do again once I stop talking. IIOP really, really appreciates your feedback. And finally, of course, we're all familiar with our own process for CPD. All of you in some way self-appraised that you wanted more information around breastfeeding and what you could do in your role as a pharmacist. Part of your plan was to attend tonight. Aoife and Deirdre have given us lots of ideas of more things that we can put into our plan. I encourage you to go on to your portfolio. If you haven't started the cycle, start it now. Put an action plan in place and you will have very worthwhile, meaningful and useful to you cycle as a result of your effort in coming along tonight. And that leaves me to say thank you and say the next In Conversation with webinar is on Wednesday, 26th of February. It's with the National Cancer Control Programme on genomics and cancer care. There'll be lots of invitations going out, and for any of you on the various social media, watch for updates, watch for further information from our speakers and others like them. And thank you all for attending. Many, many thanks to Aoife and Deirdre, a night to remember.
Thank you so much, Cecily. Thank you. And thank you to everyone for attending.
Thanks, everyone.
Good night, everyone.
Good night.
Bye.